Hey students, I am just going to go through Chapter 2 homework, and I know you didn't have to do assignment 2.1, the review questions, but I thought maybe a few of you would like them just to have to study from. So with this here, you can go ahead, pause this tape, replay it, look at the answers. Let me know if you have any questions at all. With this, I'm just going to go through number 4, and we're going to be going through this soon, within, a few weeks. But drugs and supplies, we get those through HCPCS codes, and you will see a lot of these when you are working in the office, that you will have to come up with a HCPCS code for a drug, which is a J code. Now, ICD-10 PCS or inpatient procedures, you will not have to deal with this at all. And then ICD-10-CM are diagnosis codes. These are used, as a diagnosis for a hospital, for a physician office, hospice, home care. Pretty much it's a national classification system, and we'll learn about that coming up too. Number 5, just make sure you read the questions, a covered entity. And it's kind of important for you to know this one too. Number 6, a business associate. So again, number 8, we go down to disclosure. Number 10 would be a breach. Okay, this is unauthorized release of patients' health information, which is PHI. You will hear that called PHI quite a bit. Okay, so let's go ahead and go to, you had to do 17 through 40. So go ahead, I will just kind of a little bit here, like I said, pause the tape so you can write these answers down. 17 was all above, 18 is Office for Civil Rights, 19 we have consent, 20 is authorization, 21 we have at the first visit to the practice. Okay, again, that's given to them right away. The MPP. So we also have number 22, which is going to be C. And 23 is C, and then 24B, 25C, and you can just kind of read through the rest. The biggest thing I want you to do is, for the true and false, go ahead and review them. I want to go through the assignment 2.2 with the critical thinking. It's probably the biggest thing that I want to just kind of relate to you, and hopefully that you understand what a HIPAA violation is. Was it an incidental disclosure or was it an actual violation? Okay, so again, pause the tape, finish up your true and false, and let's move on to 2.2. Okay, so number 1, we have Dr. Practon's office sign-in sheet asks patients to fill in their names, appointment times, and physician names. So what do you think here? Well, this is just an incidental disclosure. Okay, and the reason is all of this is permissible as long as the reason for the visit or the patient's medical condition is not listed. Okay, number 2, it's Monday morning. You are at work and there's a lot that needs to be done. You receive a telephone call and you give patient information without confirming who is on the line. Hopefully everybody got this right. This is a violation. You cannot let others hear your conversation about patients who have medical conditions that are considered confidential information. Number 3, you send a fax, but accidentally you switch the last 2 digits of the fax number, and the patient's billing information is received in the wrong location. Okay, even though you probably didn't mean to have this done, but it's still a violation. Steps should be taken to have the recipient destroy the PHI. Make sure you cover your tracks on this. Make sure, again, it is destroyed. Number 4, we have you're in a high traffic area where patients might overhear PHI. You are careful to keep your voice down. Okay, this is an ID, it's incidental disclosure. It is necessary with this to maximize your efforts to avoid disclosure of protected health information throughout medical offices. Okay, 5. It is 10:30 a.m. and you go on a coffee break, leaving 2 patients' charts on the checkout counter. Again, this would be definitely a HIPAA violation. Okay, it's your duty to ensure that non-staff persons will not access the patient's medical records. You want to make sure these charts are face down in the reception area so that the patient's name is not exposed to other patients or any visitors coming to your office. Number 6, in the reception room, a patient, Martha, overhears your telephone conversation even though you spoke quietly and shut the glass door. Okay, so again, Martha must have some pretty good hearing. So with this is an ID, incidental disclosure. You've taken all the precautionary measures to avoid unauthorized disclosure of PHI. 7, what's going on here? You have a telephone patient, Alex Massey, to remind him of tomorrow's appointment, and you leave a voice message on his answering machine. This again is incidental, and with this, keep in mind, use care in the choice of your words when leaving a voicemail message. Just in case it was received at the wrong number, leave your name, office name, and return phone number. Number 8, we have 3 patients near the reception area of the office. Overhear you telling another staff member that Daisy is scheduled for a pap smear tomorrow at 4 p.m. Okay, keep in mind, we did say her last name. Okay, you don't want others to hear your conversation about patients who have medical conditions that are considered, again, confidential information. Number 9, once again, you telephone a patient, Janet Hudson. She is not at home, so you leave a message on her answering machine that her breast cancer biopsy results came back negative. Again, this is a HIPAA violation. Never provide information about the results of a test to the patient or leave a voicemail message about a test. The physician has to do this. Okay, number 10. You call out Fran O'Donnell's complete name in the waiting room where other patients are sitting. This is incidental. A patient's name may be called out in the reception room. However, some offices prefer to use just first names, not call out last names. This would be just an incidental disclosure. Number 11. You do not close a glass window to the reception room when talking on the telephone with your sister. Okay, so with number 11, this is one of our first ones, neither. Okay, talking to your sister on the telephone does not come under HIPAA, unless, again, you're talking about a medical condition. But if you're just talking about what's going to happen this weekend, it's neither. Number 12, the office nurse tells a patient, Hugo Wells, his test results in front of his relatives in a treatment area. Okay, this is ID, incidental. Healthcare professionals may discuss a patient's condition over the telephone or in a treatment area with the patient, a provider, and or a family member. Okay, number 13, we have you leave Kathy Zontag's medical chart open at the reception's counter. Again, this is a violation. You have to make sure that nobody else, non-staff, can access patients' medical records. 14, you telephone a patient, Jose Ramirez, leave your name, the physician's name, and your telephone number on his answer machine. This is fine. Okay, it's an incidental disclosure. Number 15, we have a patient, Kim Lee, in the exam room and overhears a conversation concerning blood test results of another patient in an adjoining room. Okay, again, you should not let other individuals hear conversations about patients who've had or who have medical conditions that are considered confidential information. So this is a violation. 16, while walking in the reception room, patient Xavier Gomez overhears a receptionist talking with another patient on the telephone about a colonoscopy appointment. This is an incidental disclosure. You want to maximize your efforts to avoid unauthorized disclosures of PHI throughout medical offices. To overhear about an appointment would be considered, again, incidental disclosure. 2 more. 17, we have Betty Burton. She is weighed on the office scale by the medical assistant. Overhears a conversation between an insurance billing specialist, an insurance company representative, in which the billing specialist is trying to obtain a pre-authorization for the patient's medical procedure. This would be an incidental disclosure. Okay, the patient's being weighed, overheard the conversation. Again, question to consider. Were reasonable safeguards considered? What was the location of the scale and location of the telephone? Seeking pre-approval from insurance company is standard procedure related to billing. Number 8, our last one, violation. We have a restaurant, a waitress overhears an insurance biller talking to a friend, telling her about a famous actress. Of course, everybody knows this is going to be a violation. You need to be confidential. You don't talk to others about patients from the office. So hopefully everybody did great on this assignment. Again, you can play this video over and over, pause it, and look at all the answers. I will be going through, I might be a little bit more lenient on correcting this one because there is a lot more questions to do. I am going to look more probably between 2.2 for correcting those mainly. So good luck and let me know if anybody has any questions.